Hi, this is Dr. Girish A C, consultant plastic and cosmetic surgeon. I am heading Curls and Curves Cosmetic Surgery Center, Vijayanagar, Bengaluru. Rhinoplasty, also called as nose job. It is cosmetic surgery which corrects the nose shape and breathing issues. The shape variations can be too many. The nose can be thick, the nose can be long or short nose. So the nose can be wide. So or any crooked nose means the deviations, S-shaped deviations or C-shaped deviations. So all these deviations and also height of the bridge if it is less height or if it is a dorsal hump is there. So any deviations from normal or if it is not matching to their face. So for these situations, so we can do rhinoplasty. In cases of cleft lip, so they will have some nose deformities. Even with them also we can correct with the rhinoplasty. Some people will have breathing issues because of the nose deviations inside, that is called as deviated nasal septum, or it can be the turbinates, that is inferior turbinate hypertrophy can be there, or the passage is very narrow, some obstruction, spurs. So any deviation which is causing the breathing issues can also be corrected by rhinoplasty. So usually we treat the septum and the shape, that is functional problem as well as the shape together. That is why it is also called as septorhinoplasty. Rhinoplasty is done as a daycare surgery under general anesthesia. So usually the morning admission happens, evening discharge will be there. So after that they can have the food normally. And we make a very small incision in the lower part of the columella, that is in the hidden part. And if we want to reduce the alar, incision will be in the alar groove, that is alar facial junction. Once again it is in the hidden area. So after this exposure, so we modified inside the nose, that is the cartilages, and the bone modifications will happen through various techniques. And also nowadays we make use of the technology, that is piezo osteotome, to do osteotomies. Finally, our aim is to give them a normal shaped nose, so which can match to their face. And after the procedure, we usually make use of splints. Externally we put external splint and internally we put internal splint, so that the swelling is under control and they can breathe through the nose. And there will be some plasters around the lower eyelid to control the swelling in the face also. So there can be some minimal bleeding which will be there for next 1 day, and after that it will stop. The pain will be very minimal, I can say, because majority would think so there will be pain because we do in the face and all. So definitely not. The pain will be very minimal and it will be controlled with the painkillers. With the discharge, so they will be very comfortable at home and they will stay for next 1 week at home because of the splints over the nose. After the surgery, so they can have normal food from same day evening. So there will be some minimal bleeding which stops after just 1 day. So post that, if they have some breathing issues, they can come to us for some suctioning. If we do the suctioning, we can remove the clots that might be causing obstruction. After that, they can breathe normally for next 1 week.